Hello everyone and welcome back to Banana Life. Today, we're going to dive deep into a topic that affects millions of people around the world, understanding anxiety and depression. These mental health conditions can have a profound impact on one's life, and it's essential to understand what they are, their causes, symptoms, and how they can be managed. So, let's embark on this journey together as we aim to shed light on these complex conditions and offer some guidance on how to navigate them. Anxiety and depression are two of the most common mental health disorders, yet they are often misunderstood and stigmatized. Anxiety is a normal and often healthy emotion. However, when a person regularly feels disproportionate levels of anxiety, it might become a medical disorder. Anxiety disorders form a category of mental health diagnoses that lead to excessive nervousness, fear, apprehension, and worry. These disorders alter how a person processes emotions and behaves, also causing physical symptoms. Mild anxiety might be vague and unsettling, while severe anxiety can seriously affect day-to-day living. Depression, on the other hand, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and/or a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. To begin understanding anxiety and depression, it's essential to recognize their symptoms. Anxiety can manifest in various ways, including excessive worry, restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. These symptoms can range from mild to severe and can interfere with daily activities. It's not uncommon for individuals with anxiety to experience physical symptoms such as increased heart rate, sweating, trembling, and gastrointestinal problems. These symptoms can be incredibly distressing and can lead to avoidance behaviors, where individuals steer clear of situations that might trigger their anxiety. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, for example hand-wringing or pacing or slowed movements and speech, actions observable by others, feeling worthless or guilty, difficulty thinking, concentrating or making decisions, and thoughts of death or suicide. These symptoms must last at least 2 weeks for a diagnosis of depression. The causes of anxiety and depression can be complex and multifaceted. They often result from a combination of genetic, biological, environmental, and psychological factors. Anxiety disorders can sometimes run in families, suggesting a genetic link. Stress and environmental factors, such as a traumatic event or ongoing stressors, can also play a significant role. Certain medical conditions, like thyroid problems or heart arrhythmias, can also cause or exacerbate anxiety symptoms. Similarly, depression can have various causes. It can result from biochemical imbalances in the brain, genetics, personality, and environmental factors. For instance, people with a family history of depression are more likely to experience it themselves. Additionally, individuals with low self-esteem or those who are easily overwhelmed by stress may be more prone to depression. Environmental factors, such as exposure to violence, neglect, abuse, or poverty, can also contribute to the development of depression. Understanding the root causes of these conditions can help in developing effective treatment strategies. It's important to note that anxiety and depression often co-occur, meaning that a person with an anxiety disorder is more likely to develop depression and vice versa. This co-occurrence can complicate diagnosis and treatment, but understanding this link can help in managing both conditions more effectively. When it comes to treatment, both anxiety and depression are highly treatable conditions. There are several approaches to managing these disorders, and the best treatment plan often involves a combination of therapies tailored to the individual's needs. One of the most common and effective treatments for both anxiety and depression is cognitive behavioral therapy, CBT. CBT is a type of psychotherapy that helps individuals identify and change negative thought patterns and behaviors that contribute to their anxiety and depression. Through CBT, individuals can learn coping strategies to manage their symptoms and improve their overall mental health. Medications can also be an important part of treatment for anxiety and depression. Antidepressants, such as selective serotonin reuptake inhibitors (SSRIs) and serotonin norepinephrine reuptake inhibitors (SNRIs), are commonly prescribed to help manage symptoms. These medications can help regulate the levels of neurotransmitters in the brain, which can improve mood and reduce anxiety. It's important to work closely with a healthcare provider to find the right medication and dosage, as it may take some time to find the most effective treatment. In addition to therapy and medication, lifestyle changes can also play a crucial role in managing anxiety and depression. Regular physical activity has been shown to have a significant positive impact on mood and can help reduce symptoms of both anxiety and depression. Exercise releases endorphins, which are natural mood lifters, and can also improve sleep, reduce stress, and boost self-esteem. A balanced diet is also important for mental health. Eating a variety of nutritious foods can help regulate mood and energy levels. It's also essential to avoid excessive alcohol and caffeine, as these substances can exacerbate anxiety and depression. Sleep hygiene is another critical aspect of managing anxiety and depression. Poor sleep can worsen symptoms, so it's important to establish a regular sleep routine and create a relaxing sleep environment. This might include going to bed and waking up at the same time each day, avoiding screens before bedtime, and creating a calm and comfortable sleeping space. Mindfulness and relaxation techniques can also be beneficial for managing anxiety and depression. Practices such as meditation, deep breathing exercises, and progressive muscle relaxation can help reduce stress and promote a sense of calm. These techniques can be incorporated into daily routines and can provide valuable tools for managing symptoms. It's also important to build a strong support system. Having supportive friends, family members, or a support group can provide emotional support and help individuals feel less isolated. Talking to others who understand what you're going through can be incredibly validating and can provide practical advice and encouragement. In addition to these strategies, it's important to recognize when professional help is needed. If symptoms of anxiety or depression are severe or persistent, it's crucial to seek help from a mental health professional. Early intervention can lead to more effective treatment and a better prognosis. Another important aspect of managing anxiety and depression is self-compassion. Being kind and gentle with yourself can help reduce feelings of guilt and worthlessness that often accompany these conditions. It's important to recognize that it's okay to seek help and that taking care of your mental health is a sign of strength, not weakness. Education is also a powerful tool in managing anxiety and depression. Understanding these conditions can help reduce stigma and promote empathy and support. It's important to educate yourself and others about the realities of anxiety and depression and to advocate for mental health awareness and support. Finally, it's important to remember that recovery from anxiety and depression is a journey, and it's okay to take things one step at a time. It's important to celebrate small victories and to be patient with yourself. Recovery is possible, and with the right support and treatment, you can manage your symptoms and lead a fulfilling life. Thank you for joining me today on Banana Life. I hope you found this discussion helpful and that you feel more informed about anxiety and depression. Remember, if you or someone you know is struggling with these conditions, it's important to seek help and support. You're not alone, and there are resources available to help you navigate this journey. If you enjoyed this video, please like, subscribe, and share it with others who might benefit from it. Together, we can create a healthier, happier world.